I'm Dr. Julia Hecking with Blue Ridge Equine Clinic, and I'm here today to show a ProStride demonstration along with talk a little bit about its uses and its benefits. So we are here today working on a horse that we're going to inject a fetlock with ProStride. And many of you maybe have not heard of ProStride or are more familiar with our more typical joint injections, which are often steroids, which help decrease joint inflammation. ProStride is a kind of newer joint therapy that is perhaps a little more regenerative, and it is a combination of IRAP and PRP. IRAP, many of you may be familiar with. We do inject IRAP into joints and have for many years, and that's where we take the horse's own blood, centrifuge it in a tube with beads, and then we take that product, which is interleukin receptor antagonist protein, and that directly helps put anti-inflammatory into the joint. So it's a combination of that plus PRP, which we hope helps stimulate chondrocytes or cells within the joint capsule itself to help make things like water and proteoglycans and help actually heal the joint in addition to anti-inflaming the joint. So, because a lot of the inflammatory enzymes that happen when a joint is inflamed are very degrading to the cartilage. So if we can both anti-inflame the joint plus put something that is perhaps more healing in the joint, we hope that we can actually really be beneficial to the joint health. So we like to do this in horses that either maybe aren't responding to joint treatments anymore, like our typical therapies, or horses that maybe have metabolic issues, and therefore we prefer not to put steroids in their joints and the risk that they would get laminitis or founder from that. Also maybe younger joints that we don't want to go sticking a whole lot of steroids in their joints yet. Or horses with a known issue that we want to maybe help to try and heal that process. So the benefit to this is that it can all be done on farm. It takes about 20 to 30 minutes. We're going to draw blood and then put it in this centrifuge, spin it for about 20 to 30 minutes, and then we're going to take the product from that and inject it directly into the fetlock. So we're just going to give a little demonstration of how that's done. So the first part of this process is drawing the blood from the horse. That's what we're doing now. And then we'll process it using the ProStride kit that is sent along with the centrifuge. That will all take about 20-25 minutes. So now we're going to centrifuge this for about 15 minutes, and then we're going to extract our plasma. And then we have to do another cell suspension and another centrifugation for another like 5 minutes, and then we'll be ready. So another of the benefits of this procedure is that it is pretty reasonably priced, again, because it can be done on farm, and it is not as expensive as things like stem cell and straight PRP. So it's a pretty economical option for people, and again, hopefully it's a little more healing in addition to anti-inflammatory than are just straight steroids.